This is Dr. William Johnson at the Center for Weight Loss in New Albany. I wanted to discuss with you briefly sleep. And sleep is very important when it comes to weight loss. In 1960, the average U.S. citizen slept about 8.5 hours per week, whereas in 2009, the average U.S. resident slept 6 hours and 40 minutes a night. It's a huge difference. And of course, as you know, obesity has been increasing significantly in this country as well. About a third of people sleep less than 6 hours per night in this country, which is very little sleep. The amount of sleep that you get actually correlates with your BMI, your body mass index, or your weight. People who get about 7.5 hours of sleep at night have the lowest BMI, or the most normal weights, whereas if you're getting too much or if you're getting too little sleep, then you tend to be more obese. Now, there have been studies of hormones. When you get less sleep, it turns out that your hunger hormone, ghrelin, which is made in your stomach and makes you very hungry, ghrelin increases, and leptin, which more or less satisfies you and makes you feel full, that decreases. So it is important, if you want to have a decreased appetite, that you get plenty of sleep. They have done studies as well showing that when people sleep less or more, that they are more likely to get diabetes. And again, it turns out that the best way to avoid getting diabetes is about 7.5 hours of sleep at night. If you deprive people of sleep, they actually will get pre-diabetic within a week or two. Studies of mortality rates also show that your lowest chance of dying is associated with about 7 to 7.5 hours of sleep. So for all these reasons, and mainly to help you lose weight, since that is the focus of this clinic, I would advise you to try to figure out how to get 7 hours of uninterrupted sleep. That means no television set, lights off, notifications on your cell phone turned off, and try this for a few weeks, and it will probably help you with your weight loss as well as your overall health. And I appreciate your time.